It's been about 7 weeks since life as we knew it in the United States was drastically altered by the new coronavirus. And this week, Congress, by a near unanimous vote, approved additional emergency spending, $484 billion more. I spoke earlier today with Representative Richard Neal of Massachusetts' 1st Congressional District about that vote and the drastically different circumstances under which it was taken.
Well, I think that we were guided through the good works and advice of the Sergeant at Arms and the House attending physician. So we were well advised as to how we should sit, again, social distancing, 6 feet from each other. And as the debate took place, members were encouraged not to sit on the floor for some of the usual banter that takes place back and forth, where actually a lot of legislating does occur. And then as the kind of arguments were being made on the floor, members were called upon from their office to come at an appointed time. And then they were given a specific amount of time that was allocated to them for the debate. And by the time we got around to the actual voting, it was done in 6 tranches, where members alphabetically were asked to come in as perhaps maybe 30 or 40 at a time. And when that was exhausted, the Sergeant at Arms alerted each office as to when the members should proceed in the next filing. So yes, I must tell you, I've had some unusual experiences, but this will be noted as one of the most critical.
And everyone wearing masks from the images I saw yesterday, and a really poignant image of...
Yeah, it's an interesting point because many of us did wear masks. It was suggested that as long as you kept the microphone in front of you, as well as the lectern, clean using wipes, that you could remove the mask for that purpose. There were some members who decided that they would not choose to use the mask as they sat in the chamber. And that was against guidance that had been offered by the House attending physician.
Interesting. I wasn't aware of that. I only saw the images of people actually wearing the masks, and then the image of the Speaker of the House, Nancy Pelosi, signing off, and you in the background, everyone wearing masks. And this was passed by almost near unanimous support. You did support the measure. It's $484 billion additional dollars. Why were you in support of it?
Well, it's actually a challenge, but it's also an easy answer. And that is that it was clear that the money for the Paycheck Protection Program had been exhausted in 12 days, $350 billion. And that needed to be refurbished. In addition, we were able to win a couple of very significant concessions. And those concessions are part of what you do in legislative life. You compare and contrast legislation that might move over from the United States Senate, or in this case, I would simply say the other chamber. So the concessions that we won, a pretty substantial expansion of money for our hospitals, an additional $75 billion, and then an additional $25 billion for testing. We are not going to build confidence to get people back into the workplace until there is a sufficient level of satisfaction that they can go back to the workplace. And I think in this case, it's testing, testing, testing. So the legislative initiative that was passed yesterday, I would describe it as part of stabilization and relief, actually COVID 3.5. I now am prepared as I write legislation to proceed to what I think will be the next round. And I also think that will be part of relief and stability. Recall there's something else here that's very important to remind the viewing audience, that through this process, we have come to assume that a V-shaped economic recovery will only occur if, in fact, we adhere to and embrace the precautionary measures that have been offered by professionals and careerists, including Dr. Fauci. So we can build the undergirding for economic support, but that won't occur satisfactorily in terms of economics until, in fact, people have the necessary hope and confidence to go back to the workplace.
I do want to get into the specifics of a few of those measures, the funding measures you spoke to. But first, I want to bring up something. Your challenger, Alec Morse, who is running against you in this upcoming November election, as you know, disagreed with your support of this measure. And he said in a statement, in part this, quote, "My opponent has power as chair of Ways and Means, but uses it to protect the financial security of corporations instead of protecting working families and vulnerable essential workers. You know, there were items in the package that you were wanted, but they didn't end up in this. Should you have voted no?
There was one Democrat in the House of Representatives who voted no.
Alexandria
I think that sums up
Ocasio-Cortez.
the argument.
Ms. Cortez voted against it.
This position is nonsense, and everybody knows it. We intend to lay out in the city of Holyoke specifically who has taken advantage of the Paycheck Protection Act. In addition, this is really not a time for political debate. This is about the health and well-being of the American people. And the last point that I would make, having a degree in political science, is the following. Democrats control one half of 1/3 of the federal government. So we have to negotiate with a party in the United States Senate that holds a differing point of view. This negotiation was a victory for the American people. And I'm quite satisfied with what I did, but here's the way to think of this, that of all the Democrats in the House, he took the position that was consistent with one dissenter. That's it.
You mentioned a moment ago the Paycheck Protection Program. The Associated Press reported this week that publicly traded firms received $365 million in money that was meant for small businesses. What went wrong?
I think the guidance from the Treasury Department was awry. I think Secretary Mnuchin, whom I discussed this with last Saturday morning, I expressed to him clearly that that was not the intention of the Paycheck Protection Act, that it was a carefully negotiated posture that we thought would come to the aid of those businesses with 500 or fewer employees. What happened here is I think some big employers used the route of subsidiaries to proclaim that they fell within the guidelines of 500 employees. Now, what's important to also understand is that the Secretary has been in touch with those companies who he believes are not in compliance with the law, and he has asked for the money back. He has also indicated that the Justice Department will carefully review the circumstances in which the money was sought. So I think that when you write legislation of this magnitude in all of 8 days, that there are going to perhaps be some moments of overreach, but not to miss the point, the long arm of justice will make sure that that money is retrieved.
So moving forward, will the money go to the small businesses that it was intended? Are you confident those adjustments have been made so the money goes where it's
Yeah, I'm very confident, as a matter of fact. Recall that in this round, I think one of the lessons that we embraced was the following. About $60 billion in this new package will be set aside for those businesses that have single owners, generally employers that have under 10 employees, minorities, women, veterans, agriculture, all of those will be included in this next round. But what's important to remember here is that there have been 1.6 million loans that have been administered in the first round. So my guess is that I believe that much of this set aside will be very helpful to those who were intended by the missionary statement of the legislation to secure the loans.
The CARES Act also provides mortgage protection, as you know, for those who really don't have the funds right now to pay their mortgage. It gives them a break for a few months. But there were reports out this morning that some lenders are telling their borrowers that there's a balloon payment at the end of that. One family reported a $14,000 payment that will need to come due if that's true for them. Should Congress step in and say, look, those mortgage payments that aren't being made in these few months should be tacked on to the end and not in the form of a balloon payment?
We think there should be some element of forbearance here, and I believe that clearly. And I also think that some relief for those individuals is very important. Recall that we are only part of the way up the hill as we go forward on this entire legislation. So I would hope that we would come to the aid of those who, for reasons well beyond their control, have fallen behind in mortgage and or rent payments.
The bill that you signed off on yesterday, as many as the majority members of Congress did, includes that money, the $75 billion for hospitals and community health centers that you referenced at the beginning of our interview. And I also understand that you sent a letter to the Health and Human Services Secretary, Alex Azar, requesting a shift in the way that money is dispersed. And you would like for the money to be shifted, as I understand it, to Medicaid patient loads. Why would you like that adjustment made?
Well, I think that what we had to do, because of the rapidity of the challenge in front of us, we had to proceed along the lines of what was available, the pipeline. So with the IRS and getting the checks into the hands of individuals, we had a tax ID number, plus we had direct deposit. With Social Security Administration, we had a direct line, direct deposit again, and Social Security numbers. Those checks have gone out. 80 million people have received those checks. In the first round of the $100 billion, 30 billion of which was tranched, and I spoke to the secretary as well 2 days ago on that, there's another consideration. And because, again, of speed and balance, what we were able to do is get that money to the hospitals that used a Medicare ID number. Now, for this round of the next $30 billion, and by the way, they will begin to see this by Wednesday of next week when we'll have a better accounting. That money will go along the lines of the Medicaid recipients. Many of our hospitals are Medicare and Medicaid dependent. And what's important here is to understand that even in these hospitals in Western and Central Massachusetts, at least half their revenue comes from Medicare and Medicaid. What is a change in the marketplace is that in a couple of instances, maybe 3 or 4, a few of our hospitals are more Medicaid dependent than they are Medicare dependent. And with the balance shifting that way, we decided to point out to the secretary that the next round had to be for those who are heavily dependent on Medicaid. So that will directly come to the aid as well. It's not a substitute for, it's in addition to what we did with Medicare, but that money will now proceed more in the direction of hospitals like Holyoke, Mercy, Harrington, and we believe Berkshire Medical Center as well. So those are parts of the consideration. And I must point something out here. The hospital aid was linked to the Paycheck Protection Act. The money for testing. So if one is to say that they're not going to vote for something like this, then what you're essentially saying is that you would not vote to assist those hospitals and provide $75 billion more of assistance, and you would not vote for the purpose of providing $25 billion for more testing. This is a moment when we need to be responsible, and we need to embrace policies that are satisfactory to the American people.
Congressman, we're short on time. Here we are about 7 weeks into this crisis. Congress has released almost $3 trillion worth of aid in those 7 weeks. And understanding that these are extremely difficult and unprecedented times, have you thought about how much debt you think this country should or may amass during this crisis?
Well, this is not about economic malfeasance. This is not about corruption. This is about an international health issue. And first and foremost, the question here is, how do we embrace the national principle? And the national principle says we come to the aid of people who need it most in America. And that's the manner and shape in which we should proceed. Interest rates are at near lows. Treasuries are at near lows. And the Federal Reserve Board has said that they can manage the outstanding debt, as well as the Secretary of the Treasury, recalling that Congress does fiscal policy, the Fed does monetary policy, and we are on accord until we get to the other side of this. There are going to have to be some places where people might feel as though we could do other things, but not to misunderstand the nature of the challenge that's in front of us. So I am okay with what we've done to this point.